This is so cruel.
What the fuck?
A while back, I made a skit showing how defensive healthcare workers can be in situations like this. Some people said I was being dramatic, trying to stir up problems that don't exist. This is the problem. When law enforcement can walk into a place of healing and remove a vulnerable patient mid-recovery, we've lost all sense of humanity. As a nurse, I took an oath to advocate for my patients, to protect them, to comfort them, and to help them heal. But what happened on July 8th in Ontario was a complete violation of everything healthcare stands for. ISIS came into a surgery center and removed a patient who wasn't even fully recovered. That's not care. That's cruelty. This breaks everything we stand for as healthcare workers. Hospitals are supposed to be safe zones, not fear factories. And if we don't speak up, we become complicit in the silence. This isn't just frustrating. This is unacceptable. And it's time we say something out loud. Thanks for watching my skit. My name is Nurse Jumpin' Jackson. Please don't forget to like, subscribe, and share this if it hit a nerve. And if you want to stay updated when I drop more content like this, click the bell so that you'll never miss a post. So let me start by saying this. The viral story going around about ICE removing a patient from a surgical center in Ontario turns out to be misleading. It wasn't true. Apparently, that individual wasn't an actual patient at the facility. They were caught running, and so they happened to run into the facility. Just because the details were wrong doesn't mean the conversation is. Because if you're a healthcare worker right now, this kind of situation still hits a freaking nerve. It's not one incident. It's about the possibility, the fear, the ethical line we know exists but feel being erased every day. Healthcare professionals are taught one thing above all: protect the patient, not the chart, not the insurance status, not the political agenda, the patient. HIPAA is a federal law. We don't give out information about our patients, period. But ask yourself, how long before that gets watered down by executive orders, political pressure, or funding threats? Because let's be real, once they start dangling Medicaid funding over hospitals' heads, demanding compliance with ISIS, what do you think happens next? Are we really going to be forced to choose between healthcare equity and government contracts? Are we going to start seeing hospitals cooperate out of financial fear, not moral responsibility? This is what weighs on healthcare workers, not just the workload, not just the staffing, but the feeling that we're being put in positions where our ethical duty could be criminalized, politicized, or flat out ignored. So even if that story was false, the emotions is stirred, the fear, the outrage, that was very real. And here's the sad part. We're not shocked. We're just waiting for the next law to pass, the next protection to be stripped, the next vulnerable patient to be treated like a criminal instead of a human being. I don't know about you. I entered the healthcare field to heal, to protect, but now more and more of us is asking, at what cost? So to my fellow nurses, doctors, techs, social workers, stay alert, stay loud, and don't ever let legality replace humanity. In my next video, I'll share 5 concrete steps you can take right now to safeguard patient privacy under political pressure, because our patient deserves more than just good intentions. See you there.